Everyone, I am Shushmita, Assistant Professor, Department of Biomedical Engineering, Rohini College of Engineering and Technology. Okay, in this presentation, I am going to present you about the medical monitoring. Okay, medical monitoring in the sense we can continuously observe the assessment of person's health status. Okay, for the purpose of early detection and treatment of any health issues or medical problem. Then medical monitoring is a continuously monitoring the patient's health status. Medical monitoring is performed in various healthcare settings such as hospitals, clinics and doctor's office. It can also be conducted remotely by using various devices and technologies such as electronic health records, wearables and telehealth platforms. Okay, this is used in many applications. Okay, it will mainly include monitoring the vital signs such as blood pressure, heart rate and respiratory rate, then monitoring the symptoms and side effects of medication or medical treatments, then for tracking and analyzing medical data over time to detect trends and identify potential health risks, supporting disease management and chronic care management programs, then for providing early detection and intervention for medical emergencies and critical events. Okay, this medical monitoring is an essential part of medical care, especially for individuals with chronic medical conditions or complex healthcare needs. It will help the improve patient outcomes, reduce healthcare costs and improve overall quality of a life. Okay, this medical monitoring involves the use of medical devices to monitor a patient's vital signs and health status. Okay, these devices can include blood pressure monitors, ECG, pulse oximeter and respiratory monitor. Okay, in hospital, the medical monitoring is performed by a trained healthcare professionals. Okay, mainly nurses, physicians, or respiratory therapists will perform this medical monitoring. These professionals use the devices to monitor a patient's vital signs continuously. Okay, and they will provide necessary treatment in case of any changes or abnormalities. Medical monitoring can also be performed remotely with the help of a telemedicine or wearable devices. This will allow the patients to receive the medical care from over distance. Overall, medical monitoring is an important aspect of healthcare that will help to improve the treatment of a patient. Then medical monitoring, vital signs monitoring. Okay, this type of monitoring involves measuring and recording a patient's vital signs such as blood pressure, heart rate, respiratory rate, temperature and oxygen saturation. Okay, next thing is cardiac monitoring. Cardiac in the sense it will monitor the any related to the heart, any events related to the heart. Okay, mainly it will measure the electrical activity of a heart and thereby detecting the abnormal rhythm or changes in the heart rate. Okay, then glucose monitoring, for monitoring the glucose level of a patient either through the blood sample or a continuous glucose monitoring system. Okay, then neurological monitoring. Okay, this type of monitoring involves monitoring a patient's neurological status such as brain activity, neurological function and intracranial pressure. Okay, then respiratory monitoring is there for monitoring patient's breathing, respiration rate, chest movement, oxygen level and any respiratory problem. Okay, then blood gas monitoring is there for measuring the oxygen and carbon dioxide level in patient's blood. Then hemodynamic monitoring is there Okay, this is for monitoring patients' blood flow, blood pressure, cardiac output. Okay, then telehealth monitoring is there. Okay, this one is using a technology to remotely monitor the patient's health status. Okay, it is mainly used for chronic diseases and for home care. Okay, this patient monitoring system is mainly for monitoring the patient. Okay, this will monitor the heart rate, blood pressure, respiratory rate, temperature, oxygen saturation, etc. Okay, these systems mainly consist of sensors, monitors, and software applications for collecting and analyze the data from the patient. Okay, this data can be displayed over a centralized monitoring system, okay, or computer or any other mobile devices. Okay, by using a patient monitoring system, the healthcare professional will continuously monitor the patient's data and they will provide prescribed treatment regarding the data available in the patient monitoring system. Overall, this patient monitoring system contribute to effective healthcare management and enable healthcare professionals to deliver a better quality while ensuring patients' comfort and safety. Medical monitoring for patients with chronic disease. Okay, chronic disease mainly include diabetes, hypertension, heart disease, and respiratory conditions. Okay, this medical monitoring system will assist by providing ongoing surveillance and valuable insights into the patient's condition. Okay, this medical monitoring system will track and collect the important data related to the patient's disease. For example, glucose monitor. Okay, this one will measure the blood sugar level for diabetic patient, while the blood pressure monitor will check the blood pressure for patients with hypertension. Okay, additionally, many wearable devices are there. These things will measure the heart rate, respiratory rate, oxygen saturation, and other critical parameters. Okay, the collected data is transmitted to the healthcare provider, then it is finally viewed in a monitoring system. This medical monitoring is also essential for patients in hospital settings. Okay, during their stay, the patients may require a continuous monitoring to ensure their safety and provide timely interventions if necessary. Okay, they will continuously monitor the patient in hospitals. Okay, if there is any changes in the normal value, they will provide necessary treatment for that particular condition. Okay, these devices will measure and display the patient's heart rate, blood pressure, oxygen saturation, respiratory rate, and sometimes even ECG, EEG. Okay, by continuously tracking these vital signs, they can identify any abnormalities and they will provide proper treatments to them. For example, patients in the cardiac unit may have continuous ECG monitoring for detecting any abnormalities in heart. Okay, then critically ill patients may require invasive monitoring system. Okay, mainly arterial lines and central venous catheters may be included inside the patient. They will directly measure the blood pressure. Okay, also it can also measure the central venous pressure and other hemodynamic parameters. Furthermore, this hospital medical monitoring include medication administration system. Okay, that is drug delivery devices, wearable drug delivery devices. This will provide the correct drug dosage to the patients. Okay, it will also remind the patient to take the medication in a right time. Overall, this medical monitoring in a hospitals plays a crucial role in maintaining patient well-being, detecting early signs of deterioration, and facilitating timely interventions. By closely monitoring the patient's vital sign and utilizing advanced technologies, healthcare professionals can provide appropriate and personalized care to optimize patient outcome during their hospital stay. Thank you all.